we're now back to hear my bill, Senate Bill 16, which is, I think it's the third year I've introduced similar legislation, an act relating to health and safety, harm reduction center, advisory committee, and pilot program. Purpose of this bill is to prevent drug overdoses by authorizing the Department of Health to create a harm reduction program for people to safely consume pre-obtained controlled substances. Medical supervision will be present to prevent overdose and make treatment referrals. Requires approval from the municipality where the harm reduction center is proposed. Creates an advisory committee charged with making regulatory recommendations to the Department of Health. So those of you who follow along with the work of the Rhode Island State Senate might remember that just 2 days ago I sponsored my first piece of legislation to go through, which was a resolution commemorating and recognizing the national commemoration of the 400,000 people who died due to COVID as of Tuesday night, the 19th. And one thing I didn't get to in my comments that I fully intended to, but I left the comment out, is that Dr. McDonald, who many of you are familiar with, who works at the Department of Health, often when he discusses the issue of overdoses, we're both members of the governor's task force on overdose, is that we're not living through a pandemic, we're living through a syndemic. And what he means by that is there are multiple pandemics going on at the same time. And the other one that this bill addresses and that he discusses, and why he and many other health professionals support this type of legislation, is that we're also going through a fatal overdose crisis at the same time that we're going through a pandemic. And I want to give you some of the numbers that demonstrate this. 2019, we had 70,000 nationally fatal overdoses. And that was considered a relatively successful year in the fight against overdose, and that had been about 2 or 3 years where it had leveled to that level instead of increasing every year. 2020, as of May, going back 12 months from May, it was 81,000 overdoses nationally. It is speculated that we will see, when the statistics are prepared, at least 100,000 fatal overdoses nationally. And the latest estimate coming out of Rhode Island is 360 for the year 2019, and probably in excess of 400 for the year 2020. And there are two reasons for this that I find important to this legislation. One of them is that the pervasiveness of fentanyl and how quickly fentanyl reacts to create a fatal overdose. And the other is the lack of access that patients have to care, and the drop-off of access to care, and also the despair that has created the level of 25% increase in overdoses after a leveling off of actually a decrease in 2019 to the previous year. And so, as you'll hear, one of the testimonies will be that the urgency of this issue. And again, this is the third year that I've sponsored similar legislation, and the Senate has passed it. This has become an urgent issue to professionals who are responsible for addressing this part of the syndemic as part of their job or part of their study, as you'll hear. And part of their effort led to a petition to the governor to have an executive order that would implement this legislation, because they felt it was that urgent, that it needed, under a pandemic conditions, that it be addressed as an emergency through an executive order. We don't have an executive order at this point, And considering the transition at the governor level that we're going through, it would be a complicated expectation for us to think that we would get one. And the reason I urged us to consider this legislation as part of legislation that addressed COVID as was our priority going into this session was because what I just explained about how we're going through a syndemic, and that one of the more devastating components of a syndemic is these fatal overdoses, and that the many efforts that we had that were previously successful to addressing this are not successful enough to do anything about the increase that we've seen through the pandemic and through 2020. And therefore, we have to reach beyond what we currently have as resources and tools to address it. And this is the most important tool that many in the profession and beyond me see as important to get to address this. And you'll hear a lot of very well-intentioned testimony to that point. And the first person to sign up that we're going to attempt to dial into this discussion on this legislation is the Mayor of Providence, Jorge Elorza. Before we get to the Mayor, Senator Calkin, did you have a question before we get to the Mayor?
I did. Thank you, Mr. Chairman. One of the things that I noticed looking over the legislation was it didn't seem like there were any protections for people who use the harm reduction centers. Was that left out of this legislation for any particular reason? What I'm concerned about is that there may be some reluctance to use the site if, say, there was, something that could, put them in jail or something like that. Yeah, if you could address that.
I'm glad you brought that up, because one thing we did last year is the Senate passed a sub-A that included those changes in statute to protect those people, and that as I've advocated for this bill over the years, people are used to the message about how important components like you just addressed are to the legislation, and they've heard it from me. And one of the things about this, about the people you're going to hear from and who will call in, is you'll hear it from somebody other than me. And I think that's really important, is that for those who are interested in looking at this issue, to think that I didn't just come up with that as a addition to the bill out of thin air, that it came out of the expertise that you'll hear from people in this legislation. So thank you for bringing up what I left out.
Thank you, Mr. Chair.
Yeah. Mayor? Mayor?
Speaking.
Thank you for joining us, and I'm sorry for the delay. We have a responsibility to be thorough with not only this bill, but the ones we've heard before this one. So thank you for waiting.
I completely understand.
Yep.
No, I completely understand. And am I up?
Yes.
All right. Well, thank you so much, Senator, for the consideration. And I want to thank everybody for the entire committee's consideration of this important bill. First and foremost, I want to thank you, Senator Miller, for championing this issue. It really is a broad and a broad issue that touches every Rhode Islander and touches every aspect of our lives. And it's an issue that just needs to be part of the mainstream conversation. And it's a conversation that we need to have. The numbers in this area on this issue are really striking. Just as a point of comparison, think of how much of a concern violent crime is, in particular murder. The reality is that there are less than 30 people who die every year of a homicide in the state of Rhode Island. about 30. That is a darn shame, and it's 30 too many. But I want to compare that to the number of people that die every single year of overdose deaths, most of them from opioids here in our state. Last year, we had 345 people die of overdose deaths, according to the Rhode Island Department of Health. Not only does that number far overshadow the number of people who die of other means, but it's a number that's growing. Since 2014, the number of overdose deaths in the state of Rhode Island has grown by a whopping 45%. It's growing, and it shows no signs of slowing down. Opioids have been a silent killer that are ravaging our entire state. And too many people have been suffering in silence from these quote-unquote diseases of despair that often lead to substance misuse. They lead to overdose deaths and even suicide. We know that anxiety levels are rising, particularly among teens. Depression is on the rise, loneliness is on the rise, substance misuse, and even suicide, as I mentioned. These are all somewhat different diseases, but they're all very much interrelated. And we know that we can do better rather than let people simply suffer in silence. And the reason why it's so important to tackle these issues head on is because we know that every single Rhode Islander at this point has unfortunately been touched by overdose. We either know someone, we're either related to someone, but we have all been touched by this scourge, and we can do better as a community. We know we can do better because we have other communities and other countries that are doing better. While here in the United States, too many people are dying of overdose deaths, other countries have led the way. As I mentioned, Rhode Island has 345 people who died last year of overdose deaths. If we employed the comprehensive approach as is recommended by this bill and took all the steps that other places and other countries are taking, if we were on par with their results in this area, instead of having 345 Rhode Islanders, that number should be more like 3 Rhode Islanders passing away each year of overdose deaths. We know we can do better, and we can't be so far behind the rest of the world in this space. We need to lead as a state, and I believe that Rhode Island could be a model for the entire nation of how we can get these numbers under control and reverse the trend which continues to grow and make sure that we keep more of our Rhode Islanders alive. We've done a lot here in our state, and I want to give great credit to the Department of Health for all of their efforts. We here at the local level have done a lot as well. But look, the numbers don't lie. They continue to grow every year, and with the level of anxiety that people continue to feel every year, I'm deeply concerned that more and more people are going to turn to substance misuse, which will eventually lead them to overdoses and even overdose deaths. It's because of these reasons that I strongly support this bill, and that we consider, and I appreciate your consideration of this bill, so that we create a harm reduction advisory committee and a pilot program to support the health of all Rhode Islanders. We look forward to working collaboratively with the Rhode Island Department of Health and all of the partners to make this happen. Thank you, Senator.
Thank you, Mayor, and I want to point out a couple of things that led to this point and why it's so important to have your testimony. Is first of all, the design and the placement of a harm reduction facility, which would include supervised consumption, which is one of the most important but also one of the most controversial components of it. It just doesn't work without a cooperating community. And where it will do the most good is in the community that unfortunately is one of the hardest hit communities, which is Providence. And to have Providence step forward and say, we understand the complexity and the controversy of going this far, but at the same time, we understand that what we're doing is not enough to make the kind of progress on this issue that all the efforts we've done to this point. And so it's really important under those circumstances that Providence has come forward understanding all the issues that surround going this next step.
Yeah, I appreciate you saying that, Senator. And, you're 100% right. And we go into this with eyes wide open about the political challenges of this kind of a center. But this is a debate, this is a conversation that we have to have openly. And that's why I appreciate you continue to advocate on this bill. There are so many people who have suffered for far too long, and we know we can do better, and I think it's incumbent upon us to do the right thing. Politically is one thing, but policy, it's very clear. We know the roadmap, we know what works, and it's about time that we implement it here in Rhode Island.
Yep, and just to back up how controversial this doesn't need to be is how successful they've been in over the 120 facilities that include supervised consumption, where there hasn't been one fatality that could be accredited to the operation of such a facility, and there has been the statistics and the data has been, and Brandon Marshall, who's testifying, is aware of a lot of the research around this, but there has been no increase in crime, no fatalities related with the operation of 120 of these operations currently functioning. So if anybody else has any questions or comments while we still have the mayor on the line. Well, thank you very much for waiting about an hour and a half longer than what we predicted might be when you would call in.
My pleasure, Senator, and thank you so much for championing this issue. And I look forward to working with you and all the advocates to make this a reality.
We look forward to it, and I wanted you to thank all your staff who have been working so hard to understand and advocate around this also.
I will do that. Thank you, Senator.
Yep. Next, we're going to try to get Dr. Amy Nunn on the line. Dr. Nunn, thank you for waiting. I know it's been a long wait. Go right ahead.
Glad to be here, and thank you so much. I will be brief because I know y'all have been here all night, and I want to just start by commending both you and the mayor for your bold leadership on a controversial issue, and for grounding the public policy response in scientific foundation. That's really important because addiction is so controversial. My name is Amy Nunn. I'm a professor of public health and medicine at Brown University. I am executive director of the Rhode Island Public Health Institute. I hold master's and doctoral degrees from the Harvard School of Public Health. We worked very closely with the Mayor's Healthy Communities Office very recently to develop a close examination and 360-degree review of everything that's happening related to overdose downtown. And we also solicited the expert input of many different stakeholders around the state and also downtown about what could realistically be done about this. And one of the most important things that we can do as a state is to embrace a scientific response to addiction. Addiction is a medical disorder and a disease that has to be treated as such. We've essentially criminalized addiction, which has led to mass incarceration rates and hasn't actually addressed the root of the problem. One of the best ways to address this is to develop harm reduction centers where people can be affirmed and be welcomed by trained medical providers, and in some cases consume drugs in a safer environment. All of the research suggests that this goes a long way to mitigate overdose deaths and overdose morbidity, and it really is the cutting-edge way to deal with this. We've been at the forefront of many different public health responses in recent years with our health equity zones, our high childhood vaccination rates, and even our response to the addiction crisis and the COVID crisis. This is an opportunity for us to lead the nation. Similar efforts have been adopted in the Netherlands and in Canada and more recently in Philadelphia, Pennsylvania. And I really do believe that this is the way forward. I also want to note that if this is couched in a medical context, it can be done safely by trained providers. the Rhode Island Public Health Institute, which I run, owns Open Door Health, which is a new health center on the west side of Providence. We serve a lot of LGBTQ populations, people who actively use drugs, and also other vulnerable populations. And we do that gladly. We are very interested and willing to provide, would be willing to be involved in a harm reduction center. I think one of the questions has been, are there providers out there that are willing to undertake this work? And the short answer is yes. I think there are many. We are one of them, and there are many others. There are lots of people who are trained in addiction medicine who would be better poised to address these problems than our correctional system would be. So I just wanted to offer those few thoughts, and I'll be brief because I know it's late. But those are really the highlights. And we know exactly, I guess I'll just add one last thing, is that, in an era of scarce resources, we need to go to where the disease burden is. And we know down to the census tracts and the exact geographic venue where people are overdosing. And that is really downtown, in downtown Providence, in Kennedy Plaza, the mall, City Hall, and in Burnside Park. That's where we need to be offering these types of services, and it's important that this center be located in close proximity to where overdoses are happening, in order to be best poised to serve the populations who are at highest risk. So thank you all so much for your time. I enthusiastically endorse the effort, and I just want to mention again that many other scientists, physicians, and public health experts agree that this is the best path forward. This is a scientific approach, and many of us are willing to be part of the solution. Thank you so much.
So I just want to let everybody know that Dr. Nunn understates her role in this effort. She's not only done the research at Brown and through her Rhode Island Public Health Institute has contracted with the City of Providence and others to do the research around this issue and other ones that is really, really important research. She's also opened up a clinic last year, Open Doors, which is well located. And as I talked about how important it was to have a community being part of this effort, and now we have a community which we didn't have 3 years ago when we started proposing this kind of effort. We now have a provider who's interested in expanding their location to potentially take on this kind of effort. And so we have a provider, we have a community, and we have a crisis that is much larger than it was even a few months ago. So we're poised more than ever, and we have the expertise, as you'll see. I don't know if anybody has any questions for Dr. Nunn. I'll add one other point in that she has my favorite accent probably in the state, and I love talking to her because of her expertise, but I love talking to her because I get to hear that Arkansas twang too. So any questions from the committee? Senator Bell.
Thank you so much, Chairman. And I more just a comment. I just really want to thank you, Dr. Nunn, for the work that you do. Open Doors has been incredibly important for people of my district, and I think it's a great initiative. So many of us were so excited when it opened, and I just want to thank you and commend you for the work you do, and for being interested in participating in this exciting program that I hope that we pass into law. I think it's a really cool and innovative idea that we should really lead with here, and I think it will make such an incredible difference in the lives of people suffering from this debilitating and so difficult disease.
Any other questions from the committee?
Thank you so much.
Other questions for Dr. Nunn? Thank you so much for hanging in there to testify.
So glad to do it.
Yeah, and I know we'll be in touch. Next, we'll move on to Seth Clark, try to get him on the line. Seth, are you there?
Yes, sir.
Go right ahead.
Thank you, Chairman and members of the committee. I'm here in support of Senate Bill 16 tonight. So I'm an addiction medicine physician at Rhode Island Hospital. I see the physical and psychological consequences of our poison drug supply daily. I've been lucky to live a very privileged life, and my first real exposure to the overdose crisis was during my medical training at the ICU here in Rhode Island. This is the first time I was caring for younger patients, many experiencing the consequences of non-fatal overdose, and others admitted solely for organ donation, having been declared brain dead. Others tonight will speak eloquently and passionately regarding the loss of life due to overdose, so I wanted to highlight the non-fatal consequences that could be addressed by Harm Reduction Center. I think of a recent patient who underwent bilateral lower extremity amputation from complications of rhabdomyolysis from an overdose, and another patient who presented with end-stage metastatic cancer as he was too afraid of stigma and discrimination to present to the emergency department until he lost his sight. A Harm Reduction Center would fill an enormous gap in our existing treatment structure that could prevent these and countless other devastating outcomes from our poison drug supply and failed war on drugs. Thank you for your time.
Any questions for Dr. Clark? Thank you so much for testifying tonight. Next, we'll try to get a hold of Dr. Brandon Marshall. Okay, we're going to skip to Anita and go back to Dr. Marshall. Anita Jacobson? Anita?
Hello.
Thank you for joining us.
Thank you. Hello.
Yeah, go right ahead.
Thank you, Chairman Miller and members of the committee. I would like to speak in support of Senate Bill 16 related to harm reduction centers. As a pharmacist for more than 20 years, I've interacted with and provided care for many people struggling with substance use disorder. But the opioid epidemic affected me personally in 2014 when my partner, Aaron, died of an opioid overdose. He was only 39 years old, and the impact of the loss of his life is still felt every single day. From what we can piece together, Aaron met some individuals who shared prescription opioids with him, and he quickly became dependent. He began to experience difficulty with the cost of and access to prescription opioids. He was alone and fighting off withdrawal symptoms. And in an effort to treat the withdrawal himself, he tried snorting heroin, but was overcome with sedation and never regained consciousness. I believe that harm reduction centers where people can use unregulated substances under the supervision of trained healthcare professionals could have saved Aaron's life and will save the lives of many people if implemented. Unregulated substances, including stimulants like cocaine or methamphetamine, counterfeit pills, or heroin, are now almost all laced with the potent opioid fentanyl. Fentanyl and its analogs are undetectable to the naked eye and quickly render a person unconscious via respiratory depression. People cannot administer naloxone, the opioid reversal agent, to themselves, and anyone who uses unregulated substances at any time is at risk of experiencing a fatal overdose, whether they're opioid naive or whether they've been exposed for many years. Additionally, harm reduction centers would be an important avenue to connect high-risk people to treatment. Treatment with medications such as buprenorphine or methadone is effective, and people suffering from opioid withdrawal symptoms, like Aaron was, can be managed with medication and then go on to connect with recovery resources. Thank you for the opportunity to testify, and thank you, Chairman Miller, for introducing this life-saving legislation, and thank you to the committee for your consideration.
Any questions for Anita? I want to thank you for sharing your personal story as part of your testimony. It's always very important for us to hear. Any questions? Thank you.
Thank you.
Dr. Marshall,
Hi, this is Brandon.
go right ahead. Thank you for joining us. Yeah.
My apologies for the mix-up.
That's right.
Thanks to the members for the opportunity to testify today. I'm an epidemiologist and professor at the Brown School of Public Health, and I'm also an expert advisor to the Governor's Overdose Task Force here in Rhode Island. I've studied overdose prevention for over a decade, and during my doctoral training in Vancouver was fortunate to serve on the scientific team evaluating Insight, which is North America's first sanctioned supervised consumption facility and harm reduction center. As Senator Miller highlighted earlier, we are on track to have more than 400 deaths from overdose in Rhode Island this year. That means that more than once a day, a Rhode Islander dies from a preventable accidental drug overdose. And we have been a leader in this state in responding to this crisis, but we clearly must do more. And I believe that harm reduction centers are a critical, proven tool in our toolkit to do so. We and others have conducted more than 100 studies evaluating the public health and public safety benefits of these types of facilities in the dozens of countries in which they operate. They save lives, they connect people to treatment, and they improve neighborhood conditions in which they are located. In 2011, I led a study showing that overdose deaths decreased by 35% after a harm reduction center was opened in Vancouver. Other studies have shown that they increase access to treatment, and that's, I think, a really important point that I want to highlight this evening. One study from Vancouver found that over 40% of clients had entered some form of treatment after 2.5 years of operation. The programs also decrease public drug use and drug-related litter in the communities in which they are located, and they have been shown to have no impact on neighborhood crime. In fact, crime rates decreased after the facility opened in Vancouver in the specific neighborhood. They finally, I wanted to highlight as well that they also save healthcare and taxpayer dollars. I was fortunate to serve as a reviewer for a recent report from the Institute for Clinical and Economic Review in Boston, which found that even just one facility in that city would save approximately $4 million a year in preventable ED visits and hospitalization costs because people can be treated inside a facility and don't need, in many cases, to be transported to the hospital, which is particularly important now that we're facing a massive COVID-19 pandemic. So, in sum, I would just say that every day we continue to lose Rhode Islanders to drug overdose, and each and every one of these tragedies is preventable. I believe that a harm reduction center in the Ocean State will save lives, and I strongly encourage you to support this critical piece of legislation. Thank you for your time today.
So, Brandon, I have a couple of questions. The 40%,
Sure.
the 40% treatment level, how does that compare to other harm reduction interventions as far as how many people commit to treatment or come out with a treatment program?
That is much higher than, say, a traditional syringe service program. And I'll tell you why. It's because a lot of that contact, usually with peer counselors or peer recovery support specialists, happens post-consumption. Typically, these facilities have places where people can hang out post-consumption, and that's where a lot of that contact and discussion and engagement happens, whereas in most traditional syringe service programs, people pick up supplies and leave. And so there's just more time to connect with people and to ask them, are you interested in treatment? Is it something you would like to learn more about today? So it's the actual structure of the facility and the fact that people are willing to hang out post-consumption that, I think is why we see that greatly increased uptake of treatment in these facilities compared to some other harm reduction interventions.
And also versus emergency rooms, how does it compare? Where somebody...
Yeah, we have a lot of fantastic programs in our state peer recovery support specialist programs, which are engaging people in the hospital who have experienced an overdose. We're studying that, and we don't quite have that number for you yet. What I would say is that for many people, that is a really challenging time to talk to them. They've just experienced an overdose. They've been reversed on naloxone. They're in a hospital. They're feeling terrible. So that's a challenging time to speak to someone about treatment. Even though our peer recovery support specialists try their best, the goal often is actually to remain in touch with that person in post-discharge to talk about treatment. Again, particularly for people with severe opioid use disorder, after they use this, when they actually feel well, and when I feel these kinds of conversations about treatment can be most effective. So even though it may seem counterintuitive to allow people to use to then talk about treatment, I really believe that ultimately can be a superior, more effective strategy than in many cases what we're doing now when we're trying to engage people when they're feeling their worst.
Right. I have one other question that's come up as we've conversed about this with researchers and clinicians is the size of Providence and Greater Providence and what the impact of the facility would be in a city this size versus or Woonsocket, which is also an interested community with interested providers, versus the scale of a city like Vancouver or Philadelphia. Are there any challenges? Are there any positives or negatives to a smaller community that anybody has looked at?
Ultimately, these programs do need input from people who live in the community and who might use the facility to be most effective, but they have been implemented in smaller communities in Canada, in Ontario, for example, so they're not just a big city solution to overdose. If you know what I mean. They are most effective in neighborhoods that are highly affected by overdose. And so, like Dr. Nunn was speaking, where they're located is important. Some modeling that we and others have done suggests that even one facility can save, dozens of lives per year. It depends, obviously, on how many people use it, but the impact can be significant, even in a smaller city like Providence. I believe we would still see those benefits and those lives saved.
Thank you. Any questions from the committee? I want to thank you, and I look forward to working further on this issue. We're lucky to have Brown School of Public Health and so many people that are involved in Brown School of Public Health that work on issues of addiction that are really going to strengthen our response. So thanks so much.
Thank you for allowing me to speak. I appreciate it.
Yeah. Next, we're going to try to connect with Haley Mckee. Haley?
Hi. Good evening. Is this Senator Miller?
Yep. Go right ahead. You're with the committee. Yep.
Thank you. Good evening, Chairman Miller and honorable members of the committee. My name is Haley Mckee. I am the co-chair of the Substance Use Policy Education and Recovery PAC. I'm also a former IV drug user, and I currently work in substance use counseling. And I'm here tonight in strong support of Senate Bill 16. So we were here testifying on this bill 2 years ago, and the Senate chose to efficaciously and unanimously pass this, a very similar version of this bill. And sadly, the Rhode Island overdose crisis has worsened exponentially. So, I'm sorry, are you there, Senator Miller?
Yeah, we're still here.
Sorry, I'm getting some weird beeping on my phone.
Yeah.
So I got some vignettes from people who I work with who are still actively using drugs that I feel is important because myself and 25 million other people who have recovered from substance use disorder are generally more accepted by society, but we didn't get here by accident. We had a lot of support, and I see a lot of current loopholes in our treatment care model because we don't actively embrace people while they're using drugs. And that's when we happen to lose people, unfortunately. And we're seeing a lot of that currently. So people who I work with, and these are their exact words, whether it's outreach or in a clinical capacity. This person, number one, says, my friend overdosed in the Providence Place restroom, and in the 10 minutes that it took for them to get to him, he was blue, he was gone. Person number two says, I realized as soon as it hit, something was wrong. I then saw my partner overdose, and then realizing that I was next, got out of my bedroom and fell down the stairs where my grandmother found me. Person number three says, my girlfriend just wants me to stay alive, so if I have a recurrence, she watches over me. Person number four says, they found me in the closet, and I don't know how long I was out for. They hit me 12 times with Narcan, and it didn't work, so they had to use the Pulp Fiction movie needle in my heart. I spent a month in the ICU, and I still to this day can't use complete sentences because I think I got brain damage during my overdose. And we hear a lot of that every single day, working on a ground level with people who are living with substance use disorder in their active use phase. And I think it's important to establish one of these medical care facilities because that's the point where medical intervention is needed, most needed. We're charging people, the public, in best case scenarios where people are found in overdoses, which happens 1/3 of the time, to assist in these cases. But if a person is also lucky enough to have somebody at home to monitor them, it's traumatizing for both the individual that is helping and the person that is overdosed. They're not medical professionals. I see a lot of potential in establishing one of these pilot programs for people so they can access proper medical care. It's evidence-based practice that has saved lives in many other countries. I see Rhode Island as being an opportunity to be the first to do something that won't be so taboo 5 or 10 years from now when it becomes a common practice. Because overdose is basically just a lack of oxygen. So if people are waiting 5 or 10 minutes for EMTs to intervene, if they're lucky enough to have a family member find them, or it's too long. The brain injuries that are coming with this overdose epidemic that aren't often spoken about because so many people are dying, and the disabilities need to also be highlighted here. So I thank you for your bill, Senator Miller, and for your time.
Any questions for Haley from the committee? Thank you, Haley. Next, we're going to try to connect with Dennis Baylor from Project Weber Renew. Dennis.
Yes.
Dennis, could you turn down your computer so we don't get that delay?
Okay, I'm stepping away from the computer, actually.
Thank you. Yep.
Yes, sir.
Now you can go right ahead for the committee.
Okay, just let me know when I'm on.
You're on.
I'm on?
Yep.
Okay. Thank you, Senator Miller, and members of the committee.
Go right ahead.
Okay. Thank you, Senator Miller and members of the committee. I'm here in support of Bill S0016. So, my name is Dennis Baylor. I am the Overdose Prevention Program Director at a harm reduction organization named Project Weber Renew. I'm also work for Anchor Community Recovery Center as a Providence Safe Station responder. Also, I'm a trainer for Narcan distribution. I oversee our outreach teams here at Project Weber Renew, and I'm a man in long-term recovery. I'm able to do these things today because I'm alive. I managed to live through my substance use disorder. So many of us who unfortunately pick up that habit and wind up using drugs are dying. There are too many of us dying. White, black, Hispanic, young, old, male, female. As we all know, it touches everybody. Now, I'm proud to be a be a person who lives in the state, because this state is very progressive. I am a member of the Governor's Overdose Prevention Task Force. I'm the co-chair of the Racial Equity Working Group. This state has done a lot, but we need to do more. We cannot keep doing the same things and expect different results. We need to step forward and do more. Now, the Harm Reduction Center, if you visualize it, don't visualize it as a place where people are just sitting around and simply doing drugs. Okay, there are people that are going to be in those spaces that are peers who can connect with those individuals, because you have to consider most of the people who are using and utilizing these places, they're not having the best lives. They're not living their best lives. They really do want more. And when they engage with other individuals who have lived those lives and have managed to pull themselves out of that, there's a connection that's made. So there are connections that are being made where, again, we can get them into treatment and detox from those harm reduction centers. We can do drug testing. See, not everybody who's overdosing, of course, is using intravenously. They're using the recreational drugs and cocaine, and most of those users do not want anything to do with fentanyl, but fentanyl is in those drugs. So the harm reduction center can also be a spot where people can come to test their drugs, to make sure that they don't get caught off guard with the fentanyl in their drugs. We can also distribute fentanyl testing strips. We can distribute Narcan. We can give them advice to make sure that if they're going to use, that they use with knowledge and the tools necessary to ensure that their loved ones, their friends, don't have to die as a result of their use. And Dr. Miller, Dr. Marshall already addressed the fact how it's also a public health issue in regards to the community. Right now, certain communities, there are people who are using in their alleyways, using in the parks, using in all these unsafe environments. We can give the people another option, another tool, someplace where we can get them out of those public spaces and into a place where they can be safe and be monitored, and again, utilize the other tools that those harm reduction centers will have for them. Even simple wound care. Some people get all of the types of diseases because of their wounds aren't being cared for. They don't go into traditional healthcare facilities, but here they go into a place like that around people that they trust and they know who've experienced the same thing, and a physician or a nurse there can care for simple wounds before they turn into something more serious. Now, I don't want to take up too much time. I also don't want to ramble on. So I guess I'm going to stop there. But again, we need to take the next step. What we're doing isn't working. We need to do something a little more. Thank you for the opportunity to speak to you.
So I have a couple of questions for you, or just comments about, I've known about Project Weber Renew for a long time, from when it was on Allens Avenue and had a staff of about 3 and a budget of about $200,000, thanks to Tom Coderre. It's come a long way, and I think you brought two things that are really important to the conversation that I want to talk about. And one is that what a harm reduction center is. It's not about safe consumption. It's about a lot more, and how important all those other services are in what I think all 120 existing harm reduction centers offer, and how effective all those services are being in one location. But I also want to talk about fentanyl, because the last time the Senate passed this bill, It's what I concentrated on to explain to those who aren't surrounded by this issue, either by job or being on the overdose commission, as often as we are surrounded by this issue, and what the prevalence of fentanyl is done to this crisis, and how it's almost required this kind of response, because so many people aren't aware of how quickly a fatality can be generated by it, either knowingly or unknowingly, because of its presence. And can you talk about just the sequence of what's happened over the last few years, and why so many people who were reluctant to the design of a harm reduction center that included safe consumption or supervised consumption, why so many people have come aboard that type of effort as it relates to the increase of fentanyl in the illicit drug supply?
Right. Well, what comes to my mind is a couple of different things. First of all, when I was young, growing up here in Providence, and I went through my drug experimental phase, which a lot of us go through, and some of us stop and go on and lead productive lives. But anyways, when I was experimenting, there was a very low chance, very low risk of me dying. It just wasn't going to happen for the most part. Nowadays, you take a young person going through that experimental phase, and they get a little cocaine, or they get a Vicodin or a Percocet or some other type of Molly, a party drug. They're at a high risk of death. I think of this one mother who I've heard about, who her two sons, two young children, teenagers, go to experiment with a little bit of crack cocaine, a little bit of cocaine, powder cocaine, experiment with a little bit of powder cocaine. Both of that woman's children died as a result of their cocaine being cut with fentanyl. It's just so prevalent in all of the drugs. The cartels, those individuals who are bringing these drugs into the country, because it's so cheap to manufacture, because it's so addictive, because it's 100 times more powerful than morphine. It's just in so many different drugs these days that having a place where I could safely go to without knowing, with knowing I'm going to not be harassed and be able to test my drugs, it's straight out lifesaver. What a life-saving move. Having something like that available will be to so many people. Again, it's not just about consuming, but it's about harm reduction tools. Harm reduction tools that are going to save lives. Now, I don't know if I answered your question directly.
No, I think you got to my point, is that, and I know it's getting late, and I hope the committee will understand that I feel it's important to give you, comes to mind 3 examples of close friends of mine whose children perished under exactly what you're saying. One of them was not what anybody would consider addicted. He decided to snort cocaine on his 21st birthday for the first time and died, right? If those drugs could have been tested before that. I have another friend whose daughter died. She used for the first time after being in recovery for 4 years, and took what she understood to be the same thing she remembered taking 4 years ago, and she died. I have a friend who was my brother's best friend whose son died. They found him with the needle in his arm and was doing exactly what he had done, like I think it was a 6-month recovery for him and he died. And all of these are unfortunately examples of what can be averted by having the services that exist in a harm reduction center, and that are happening accidentally with the lack of those kind of services that have now arisen, all three with a fentanyl component that they would otherwise survived without it. And that's the difference, and the difference I made clear without those personal examples the last time we passed this bill on the floor.
Well, I thank you for sharing it with us. Yes, sir. But you're right. It's a perfect example of lives that possibly could have been saved if there were that type of harm reduction center available to them at the time. Yes, sir.
Any questions from the committee before I go on to the next person who we're going to try to get on the phone? Well, I want to thank you, Dennis. You're an important citizen to the community of Providence, no matter what happens with any piece of legislation. And I'm glad to know you and your boss and everybody who works with you.
Thank you, Senator Miller.
Yeah.
Thank you very much.
Yeah.
Okay. Goodbye.
Next person that we'll try to get on the phone is Trevor Gaskell. Trevor?
I am here. Hi, thank you, members and chairman. I'll keep this brief. My name is Trevor Gaskell. I was addicted to heroin for 20 years. I ended up, in the end, doing 6 years in prison for a bank robbery spree before attaining sobriety. I just wanted that to qualify as so you know that I was out there every single day, and I know what it's like. My testimony will be a lot more personal than data and fact oriented, like it was from some of the medical professionals, and I'm glad that they added that very important data to this conversation. In my personal experience, when I came home in November of 2018, after 6 years of fentanyl, when I went away in 2013, fentanyl was just hitting the streets. And when I came home, everybody that I knew, everybody in my circle of heroin injecting drug users from Providence, everyone that I knew was dead. There were like 2 people that got clean. Everybody else was dead. Nobody was alive. Nobody was alive to welcome me home on Facebook, or they were all dead. My family and such, but anybody that I had used with for the last 15 years before I went away on my bank robbery sentence, they were all dead. For that reason, this is such an important piece of legislation. Chairman, you did address in the very beginning the need for an addendum. I don't know if it's already in there, about there does need to be some protection from law enforcement for the patrons. The first time a police officer parks outside, comes inside, or arrests someone coming or going, that place will be abandoned. Where it travels fast in a small city like Providence, and the circle of hardcore users is known to be pretty tight. So if there's ever a sting anywhere or something like that in Providence going on, that word will travel fast. And if there's a safe injection site, and anyone gets busted there, or there's a state trooper sitting outside, you can just abandon it yourself. There'll never be anybody there again. So that's going to be an important criteria that needs to make it onto the bill. The one that I read, Bill 16 that I read, I didn't see any criteria like that in there. But I guess it has been addressed, so I'm just hoping that key component is in there, because without that, this place isn't going to last very long, and it isn't going to help very many people. I overdosed about 6 times. The last time was in Walgreens on Atwells Avenue. They had a public bathroom at the time when they were brand new, and the only reason I'm alive is because the patron just happened to walk in. I didn't have any place to go. these local businesses in Providence, especially on the west end, south side, in downtown areas where you can use a bathroom, they're calling 911 all the time. People don't have a safe place to go. And the game's changed. The game's changed. I was not around for fentanyl, but I am aware of the numbers. I'm aware because everybody I knew when heroin was in the streets, and now it's just fentanyl. But when it was just heroin, people lived for more than a couple of years. Now it seems everybody's dead. So the game has changed. This is a serious problem, and it does need to be addressed. And it seemed like there was some tunnel vision before with the legislature. Not speaking to any of you in particular, but it just seemed like the solution would always be more rehabs, more detoxes, more treatment centers. And the fact is that, like, at least for me, speaking for myself, there was a good 10-year stretch that I didn't want to get clean. So I didn't care how many rehabs you put in Rhode Island. It didn't matter to me. I wanted to get high. And so all this funding for detoxes and stuff like that doesn't address the people that just aren't ready or aren't willing to fight for their sobriety yet. And we don't want those people to die. And that's why this is such an important piece of legislation. Because they are dying. They're dying every day. No amount of money, no amount of budget, no amount of rehabs or detoxes is going to do anything for the person who decides that they're not done using. You put them in prison, they're going to they'll use in prison. I did. So there's hell or high water, they're going to get high. I just like to see their life saved. And yeah, that's it. I guess that's all I have to add from a personal experience. For a long time I didn't want to get clean, and we need to save those people too. Because if they live long enough, maybe one day they'll attain sobriety and come around the corner. I hate to say, make it like me, but now I'm a homeowner. I'm a published author. I'm the breadwinner for my family. I'm a grandpa chasing around little kids, and I've been clean. I don't, I pay my taxes. I contribute to society. I testify on bills. I do charities, Special Olympics. I do, I'm a good member here. I'm a valuable addition to Rhode Island. So if the rest of us that were, living the life that I had lived right now, if they live long enough, they can do that too. We just have to make sure that they're alive to see it. And yeah, so I think that this is a very important piece of legislation. I'd love to see it passed. I'm not sure how the criteria was written in with the immunization or the other worded protection from law enforcement, but as long as that's in there, this is a promising bill, and I'd love to see it passed. So thank you so much for hearing my testimony.
Well, thank you for coming forward with your own story. It's always very important to us to hear from those who are successfully in recovery. And one of the reasons I wanted to hear this bill, even though it didn't have those protections, is the last bill we passed in the Senate, or in the committee, actually had those protections in it. It was a sub-A, and we regressed back to the bill that didn't have those protections. But to me, it's very important that between Senator Calkin and some of the people who've testified how important those protections are, coming from other than me is important for I think everybody involved with this type of legislation to hear that the importance of those components of the legislation didn't just come out of thin air. Senator Bell?
I just want to echo those comments. I strongly believe that we need to make these liability protections clear. The way it's written to the current draft of the bill is simply that the committee will advise the Department of Health on regulations on liability protection, but I think there could be some potential issues with the Department of Health having the legal authority to waive that if it's not spelled out entirely clearly. I think possibly they might be able to do it under this, but
Well,
I think it would be
also-
so much better
yeah.
if we just made it
To
explicit.
clarify,
So I just
also-
wanted to echo that comment.
Also in the sub-A, added to the advisory group was the Attorney General's office, which does have the authority to navigate those issues. To have an effective harm reduction center, you would need these statutory changes to protect it. And so also in the sub-A was the addition of the Attorney General. So it wasn't just the Department of Health advising and cautioning on what we could do statutorily and what we couldn't. And so one of the discussions that's ongoing with the Attorney General's office is obviously we can recommend these statutory changes and protections, but we can't get rid of the federal obstacles. And we have to go into that fully understanding that. And my discussions with them on why they should be enthusiastic about being included is to advise on what they can do statutorily locally, but what they can't do federally, and to specifically identify that so we can go forward and advocate on a federal level, which seems a lot more promising after yesterday than it was on Tuesday on how much cooperation we might get on a federal level on this type of issue. So.
Yeah, I think that this is a promising bill, and I think that as long as we can get it passed, it's better even without the protections included statutorily. Hopefully, local law enforcement will, for the most part, respect the boundaries that will be saving lives.
Yeah.
Because obviously, if a state trooper's parked outside, he knows what he's doing, and nobody's going to go there, and nobody's life is going to be saved. And then 10 minutes down the road, he'll be responding to a call from the McDonald's bathroom when someone could have been in there safe, and now he's going to go respond to this call, and like less calls for them. Maybe even benefit them, even without the protections. Even without the protections written in, or maybe further down the road, if we can, if we pass this as is, and then we can demonstrate, statistically,
Trevor, we're going to get this right. We're going to include that language. We were successful in getting that language in before. So I'm optimistic we're going to get this right and include that language.
That's great.
Just one other question. In your now published writing, do you talk about your bank robber days?
It is. It's a memoir available on Amazon.
Okay, great.
So you go to Amazon and type in my name.
Okay, we will. Thanks.
Okay, thank you, Chairman. Have a nice night. Thank you.
Okay. Next on my list is Lisa Peterson. We're unable to connect with her, so we'll go to Michael Stevens. Michael?
Yeah, I'm here.
Okay, you're on with the committee. Go right ahead.
Okay, thank you, Chairman. Have a nice.
And turn down your, whatever you're watching on, turn that down so we don't get the delay. Thanks.
Thank you. So thank you for the opportunity to speak today in support of Senate Bill 16. My name is Michael Stevens. I'm a Cranston native and a medical student at Brown University. Over the past year, my classmates and I have interviewed a number of addiction medicine doctors, peer recovery coaches, and patients with substance use disorder. We listened attentively to their lived experiences and their ideas to reduce overdose deaths in Rhode Island. Through these conversations, we learned the next solutions to the opioid epidemic in Rhode Island won't happen at the doctor's office or hospitals. They'll be found within the greater community. Rhode Island has seen progress in recent years, from medication-assisted treatment for inmates at the ACI to the recent buprenorphine hotline, to expanded access to clinicians and peer recovery coaches. However, even with these newer resources, the overdose epidemic is still growing in Rhode Island and affecting more and more of our citizens. Our state will require multiple major policy changes if we hope to reverse the course of the opioid epidemic. We will need to look outside traditional healthcare settings to the environmental conditions that caused the crisis and continue to fuel it. A great step toward doing this would be implementing a harm reduction center program. meeting patients where they are in the community and creating spaces for them to access care in a timely and effective manner are essential steps to reducing overdose deaths in Rhode Island. Harm reduction centers could achieve these goals and also help patients get connected to much-needed preventive health services and other educational resources. These centers have already shown promising results in Canada and Australia, as mentioned earlier, where the centers have had nearly zero overdose deaths on site. And also to ensure a safe rollout of this program, I'm excited that the bill would establish an experienced and well-balanced advisory committee consisting of representatives from the Rhode Island Department of Health, physicians, and I think most importantly, Rhode Island citizens who live with substance use disorder. Therefore, my classmates and I are confident this bill would make real change in the opioid crisis in Rhode Island. I want to thank the sponsors for making this a priority early in the legislative session this year, and I hope to see it pass through later this year. I urge you to continue reaching out to scientists familiar with harm reduction centers and get some more advice on their implementation. Thank you for your time tonight.
Thank you for calling in. Any questions for Michael? Thank you so much for calling in.
Thank you.
Next, we'll try to connect with Anna Jane Yokin from Project Weber Renew. AJ, go right ahead.
Yes, thank you. Thank you, Chairman and members of the committee. My name is Anna Jane Yolkin. Many people know me as AJ, and I'm a co-chair of the Substance Use Policy Education and Recovery PAC. I'm also a staff member at Project Weber Renew with Dennis, who you heard from earlier, and I'm testifying in support of Bill number 16. So I've been part of the effort to support harm reduction centers for the past 4 years, and we've had so many meetings, so many conversations. There's been so much discussion, and since I've started working on this effort, over 1,400 Rhode Islanders have died from a fatal overdose, with 2020, as we mentioned earlier, being the deadliest year on record. So we've been talking about it a lot. It's an official recommendation from EOHHS, and now is really the time to take action to create a regulatory framework and codify some of these things into law so that we can really save lives. I've also talked to dozens of lawmakers on this topic. Sometimes I get the question, don't people think this is kind of controversial, what you're doing? And I'll say that your colleagues really understand the need for this. I remember last year I was talking with one lawmaker, and I was going on about all the evidence, how no one has ever died in such a facility, how they save money, blah, blah, blah. And the lawmaker just respectfully stopped me and said, I get this. This is the type of facility that would have kept my cousin alive. And I think it's also really important now that over half of overdoses that are happening in downtown Providence are happening in public locations. This is really the type of center that could help support people in that and who have nowhere else to go. I'd also really like to highlight some of the conversation that's been happening around the liability protections that Senator Culkin brought up, that other testifiers have brought up. I'd really encourage that we include the protections that were included in last year's Sub A. These protections would protect the medical professionals, staff members, the clients, the property owners from criminal and civil liabilities if they were operating or utilizing such a facility. And this is really important because there are some components of our state's Uniform Controlled Substances Act, such as the Public Nuisance Clause, where someone could, if it weren't explicitly mentioned, that people seeking out medical services wouldn't be covered under that could be prosecuted. And so I think we just really need to put that into law so that, as Trevor mentioned, people feel very comfortable going to a facility and that they actually do work and actually are accessible to people. I want to highlight one other thing to that point. My colleague Ashley, who might speak later today, conducted a study with some of her clients to see what they thought about harm reduction centers. As we mentioned earlier, it's really important to get feedback from people who actually might use such a facility. And importantly, 3 out of 4 people said yes, they were really interested in using a facility if one existed in the state. However, over 83% of the people that she talked to were specifically concerned about law enforcement or being arrested at such a site. And so that's why I think it's really important that these protections are codified into law so it's very clear that people are safe to use them. Thank you so much, and Senator Miller, thank you for your leadership on this topic.
So, Anna Jane, I don't want to cut you short on what you've done on behalf of this type of legislation and many other things that you're involved with. Could you talk about your advocacy and how many people you had sign up to advocate on an executive order, just so they know how much people who have studied this issue and professionals in our medical community and beyond, and patients participated in that effort.
Absolutely. So I was part of an effort, along with many other people, to write a letter to Governor Raimondo asking her to authorize an overdose prevention site or harm reduction center in light of this crisis, and also importantly to declare a state of emergency for what is happening, so that really we can highlight what an important issue this is, in addition and in tandem with the COVID-19 pandemic. We had over 500 people respond and sign on to that letter, people representing medical professional organizations, people representing businesses, harm reduction organizations, individuals, just a lot of people who came together and said, yes, we want the governor to use her ability in this moment where there is this crisis to authorize such a site. That's something we're still working on, and I think it's important that we're pursuing this legislatively by executive order and whatever means necessary.
Thank you. I just didn't want to get that work and that number of 500 people who are medical professionals or represent them or patients that are involved go by unrecognized.
Thank you.
Any questions from the committee? Thank you.
Thank you so much.
We're going back to Lisa Peterson to try her again. Lisa, go right ahead.
Thank you, Senator, and thank you, committee members. My name is Lisa Peterson. I am the Chief Operating Officer at VICTA. We're an agency providing substance use, mental health, and medical services over on Elmwood Ave in Providence. And I'm also another co-chair of the Substance Use Policy Education, Prevention, and Recovery PAC. I'm here to offer my strong support for this bill and to really advocate for the creation of an overdose prevention site as soon as possible for the state of Rhode Island. One of the central tenets of our treatment model for substance use care is based on the stages of change, which was actually created right here at the University of Rhode Island by Prochaska and DiClemente. It is widely referenced as the model for changing any type of behavior related to health conditions and general behavioral change. It really reflects our human processes of thinking that we might be ready to make a change, wanting to make a change, having second thoughts about that change, having a recurrence of old behaviors, etc. So anyone who's ever decided that on January 1st they're going to make a resolution to go to the gym or to eat more healthy foods, you know that there are fits and starts to that kind of change. So for individuals living with substance use disorder, we really have to tailor our interventions to the stage of change that they are at on any given time and any given day in order to be most effective. So for folks who are not yet considering recovery and are not contemplating whether they would like to stop using substances, forcing a model that says you need to go to treatment, A, is likely to get pushback, and B, is likely to result in sort of disengagement, passive approaches, and then for the folks involved to see that as a failed treatment episode if they continue to use substances. So what we try to do at VICTA and what we hope to do with overdose prevention sites is to engage folks who are what we call pre-contemplative, not thinking about making a change at this time, and engage them, meeting them where they are, and trying to help them stay alive, as folks have referenced earlier in this testimony. We need to help educate them about ways that they can keep themselves safe, ways that they can minimize their risks of overdose, infectious disease, etc., and help them take better care of themselves so that if and when they find recovery, they're in the best possible position to maximize those gains. As folks have mentioned, we've had the worst year on record for overdose deaths in Rhode Island, so this is becoming increasingly urgent. Another issue that is really pressing us to act with some urgency is because of COVID-19 as well as many other factors, there has been a significant shift in the drug supply. It is changing quickly, and for folks who believe that they are using fentanyl, because honestly, there's no heroin in Rhode Island anymore. Folks are using fentanyl intentionally and developing tolerance for that. They are now being hit with carfentanil, which is an analog that is 100 times more potent than fentanyl. We are seeing that at VICTA in our urine toxicology results, and folks have no idea what they're consuming. So as long as there is not a safe and predictable supply of drugs, there is going to be no really safe way to use. Folks who were mentioned earlier on the call as well are seeing fentanyl and carfentanil mixed in with things like cocaine and methamphetamines, which are on the rise in Rhode Island, also substantiated by toxicology results at VICTA. And even the fentanyl test strips, which were phenomenally helpful as the fentanyl crisis first began in our state, they're not picking up on carfentanil, and that leaves folks with a false sense of security. So if somebody buys what they believe to be fentanyl, test it. Of course, it does not show, it shows for fentanyl, which they would expect they use, but now there's carfentanil, and that was much more impactful than they expected. That's also happening with things like quote-unquote homemade benzodiazepines or pressed pills. So many of our clients are seeing their toxicology results and are absolutely stunned by what they've ingested versus what they thought that they were ingesting. So one of our tasks as clinicians who are working with folks in pre-contemplation is to provide a safe environment where we can share information about these issues. We can talk to people about what we are seeing in the drug supply, to talk about the risks, to offer them options without pressuring them if they are not at a place where they are ready to accept treatment per se. And an overdose prevention site, a harm reduction site, the language du jour is really a critical place for us to be able to do that, where we can allow folks to, in a perfect world, check their drugs before they use them, know exactly what they're using, use under supervision and safe conditions, where if something does go awry, somebody is right there immediately to intervene, save the life, and to simultaneously be developing those relationships that ultimately do help people want to engage and engage more successfully in treatment if they decide that recovery is a path that they are interested in. I think that it's important to note that the stages of change model does not just apply to clients with substance use disorder. It applies to all of us as human beings. So I see the advisory committee as really being able to provide that same evidence-based information, combat stigma, combat myths, to help communities want to embrace this as a way to take better care of our friends and neighbors who are using substances. I will wrap it up with that, and I want to thank you, Senator Miller, for your leadership with the substance use crisis, and thank you all committee members for taking the time to hear us all tonight.
Thank you. Any questions for Lisa Peterson? Thank you so much. The next person that we're going to try to connect with is Hannah Stern from the ACLU. Hannah?
Yes.
Go right ahead. Go right ahead.
Oh, hello?
Yes, go right ahead. You're on.
Hi. Thank you, Chairman, members of the committee, for your time this evening. I hope you're all well. My name is Hannah Stern, testifying on behalf of the ACLU of Rhode Island. I want to thank Chairman Miller for introducing this really important legislation again, and I'm here to voice our very strong support for this bill. We did submit written testimony, so I'll be very brief. We're highly supportive of this legislation for the many reasons that the testimonies before me have touched upon. But I'd also like to quickly thank Senator Culkin for additionally asking about the law enforcement component, and I know that we've heard this concern echoed in a few other testimonies, but this would really be the main amendment that we would propose to this bill as well. As has been noted, the sub-A passed last year on this bill, and it included a provision which would grant immunity from liability for violating any of the state drug laws, not only to clients, but to the employees and volunteers or owners or other personnel who utilize or work within the harm reduction center. And we think that this protection is pretty essential in order for these centers to be able to operate without the potentially devastating law enforcement related consequences. So for those reasons, we would additionally encourage the inclusion of those specific statutory protections which were included in last year's survey in this year's version. But overall, we applaud the introduction of this legislation. We hope that it is again favorably considered, and we appreciate its introduction. So thank you. And thank you for your time. I'd be happy to take any questions you might have.
Any questions for Hannah? If not, we'll move on to the next person that we're going to try to call into, which is Dr. Elizabeth Samuels from Brown Emergency Medicine. Dr. Samuels, go right ahead.
Can you hear me?
Yes, we can.
Okay. Thank you, Senator Miller, and to the committee for letting me speak tonight in honor of this bill. My name is Dr. Elizabeth Samuels. I'm an emergency physician and assistant professor of emergency medicine at Brown. I'm a researcher, and I also work clinically at Rhode Island and Miriam Hospital emergency departments. And I'm speaking to you today strongly in favor of Bill 16 and advocate for expanded liability provisions to ensure the effectiveness and public health benefit of such centers that we hope to open in Rhode Island. As has already been mentioned by several of the speakers, Rhode Island's overdose crisis is one of the worst in the nation, and over the last year has only intensified. 2020 has been our deadliest year on record. Confirmed deaths from January to September alone exceeded deaths from any prior year. I care for people in the emergency department after overdoses, and opioid overdoses in particular, every shift I work, and I know that we can and must do better for our neighbors and community members who use drugs or who have a substance use disorder. And while we've significantly improved what types of treatment and care is provided in the emergency department after an overdose, the majority of people we see for an overdose decline on-site counseling at time of the ED visit or engagement in treatment, which is for multiple reasons, but I think it really underscores the need for harm reduction centers where people can engage on their own terms with people they trust at a time when they're able and willing to engage both with treatment, but harm reduction, and to identify and meet their life goals to lead a healthy and fulfilling life. So harm reduction centers is the type of person-centered public health approach that we need for this crisis, which really respects and honors people's dignity, engaging folks on their own terms and working to improve their health and well-being. Every overdose death is preventable with prompt administration of naloxone. Every opioid overdose death, every single one. The Rhode Island drug supply, as has already been discussed by others, is increasingly deadly, and to prevent a death really requires immediate intervention and prompt administration of naloxone. Rhode Island has prided itself on working for an evidence-based public health approach to address the overdose crisis, and has been a leader in developing and implementing innovative policies and programs to address the crisis, including expanding naloxone access. But while this has saved many lives, we really need to do more. And as we've been a leader in nationwide and other things we've done to address the crisis, harm reduction centers, also referred to as overdose prevention centers or supervised consumption centers, are a proven evidence-based strategy we have yet to employ here. There's over 120 centers across Canada, Australia, and Europe, and there has never been a death in any of these facilities, not one. This alone should be reason enough to spur us to establish these facilities in Rhode Island. And as Dr. Marshall has already discussed, their public health benefits go beyond reductions in mortality. They include increased treatment enrollment among people who use drugs, reductions in HIV and hepatitis C, as well as reductions in public substance use, injection-related litter, and crime surrounding areas where these are established. These are all the public health benefits we are striving for, and they've been demonstrated in multiple centers in multiple countries over multiple decades, and we deserve to have those same benefits here in Rhode Island. Done correctly with provision of wraparound supports, harm reduction services, and low-threshold treatment access, harm reduction centers in Rhode Island will save lives. But for these centers to work, as was already mentioned, the current legislation must be modified to include protection from both harassment as well as liability protections from civil and criminal prosecution, not only for people who use the center services, but also for the staff who work at them and building owners that house them. The real legal barrier to these types of provisions is Rhode Island's current crack house statute, and the current legislation must contend with that for these to have the public health benefit we know that they can have. Like with COVID, for multiple years now, we have been in an all-hands-on-deck situation. But to effectively deal with the overdose crisis, we really need to use every tool and strategy we have available. And this is a proven strategy that we know works in multiple different situations and can work here in Rhode Island. They have tremendous potential to reduce substance use-related illness, injury, and death. And we really have an opportunity to lead yet again in caring for the health and well-being of Rhode Islanders. And I believe that we really are obligated to seize the chance to do so. Thank you, Senator Miller and the committee, for your time and allowing me to speak in favor of this bill.
So, Dr. Samuels, I just have one question, and it might just be a reiteration of what we already heard. I think Dr. Marshall and Dennis Baylor, I brought this up, but you're an emergency room doctor that might be able to lend some emphasis to this around why a harm reduction center with safe consumption and so many other resources has such a better result in getting people into treatment than an emergency room when somebody presents with the same circumstances, and how the complexities of doing it in the emergency room rather than a facility like Toronto or Vancouver.
Yeah, absolutely. So just to speak for anyone who's not cared for someone who's had an opioid overdose, immediately after you give someone Narcan or naloxone, which is a life-saving medication, the person immediately goes into withdrawal. So you do save their life. However, the person who's received the naloxone while they are alive, which is a very good thing, they do not feel well. They feel very, very sick. They're nauseous, they're vomiting, they may have diarrhea, they have abdominal pain, their body aches. They feel like they have all of a sudden, like the worst flu you've ever had. So imagine being in that state and how receptive you might be to really anything. Feeling sick and feeling vulnerable. Maybe being in a place where, especially now during COVID, when we're not allowing people, friends and family members in the emergency department to prevent transmission of COVID to others, and reducing any kind of increased numbers in the healthcare setting. The receptivity at that time is not the best time to really engage folks. But engaging people at a time when they are feeling more well or not feeling ill, they're much more receptive, especially folks with substance use disorders, many of whom have experienced a lot of trauma for very good reasons, have a lack of trust for people, especially in more formal healthcare settings. They have not had good experiences. They have experienced a lot of stigma. But needing services or receiving services from people you have longer-term relationships with, you've built relationships with them over time, you see them frequently. A lot of the studies that have looked at treatment engagement, the people who really engage in treatment the most are the people who use the facility regularly. And that, I believe, is really because of these relationships that people develop and the trust that they develop to then take a chance on themselves, to be able to say, you know, I wasn't ready before, I built a relationship with this person, I'm going to engage in treatment. That I think is one way that one reason I think that engagement at a harm reduction center would far exceed that than we would see in the emergency department. People are just not in the right place. Now, granted, there are many people we are able to reach in the emergency department, but we need to do better. We need to have options to reach more people because we're not reaching enough. And then your second question was about whether we'd see the same impact in Providence. Is that correct?
That was just, I had asked somebody about the scale of Providence versus other cities.
Yeah.
You can respond to that if you want, but we can also move along if you want. Yeah.
Well, I would say, I think that I agree with what was previously said, that we would see a benefit, but I do think ultimately the crisis in Rhode Island is really different than a lot of major urban centers, and I think we will need different models of different types in Rhode Island as a whole state to see a benefit in some of our less dense areas. Is a brief answer to that. But I do think in Providence in particular, or in Woonsocket in particular, we would see a significant impact locally.
Thank you. Any questions? Thanks so much for sticking around to add your voice to this.
Thank you, Senator Miller.
Yep. Next, we'll try to connect with Ashley Perry from also works at Project Weber Renew. Ashley?
Yeah.
Go right ahead.
Hello.
Yeah, go right ahead. We have you on.
Thank you, Chairman and members of the committee. I am here in support of Bill S0016. Can you all hear me?
Yep, go right ahead.
Okay. Thank you, Chairman and members of the committee. I am here in support of Bill S0016. My name is Ashley Perry. I am a person in long-term recovery from opioids, and I currently work at an organization called Project Weber Renew as a peer recovery specialist, concentrating my efforts on street-based outreach, providing harm reduction tools and education, and case management to some of Rhode Island's most vulnerable residents. Today, instead of telling you all that harm reduction centers are the only evidence-based way to save lives that we haven't tried yet, or the sad and disappointing numbers of lives lost, or the pure trauma and devastation that I have witnessed firsthand working on the front lines of both this pandemic and epidemic, I would like to tell you all the story about Dawn. I met Dawn on a warm October day. I will never forget. I was doing my normal outreach rounds when I observed what I thought were two men breaking into a car. When I got closer, I saw that they were actually trying to get someone out of that car. That someone was Dawn. I soon realized she was experiencing an overdose. I quickly drew up some Narcan, and as the men broke her free from the car and laid her on the sidewalk. I started this process that I had taught hundreds of people hundreds of times. I performed full CPR on Dawn and injected her with over 5 units of naloxone before the ambulance even arrived. But still, she was lying there lifeless. The EMTs took over, and finally, after some work, she came back to life. When I finally stood up, I just wept. I looked around me and saw the whole community had stopped to watch the horror. There were children getting off the bus, and I wondered what their mom would tell them or explain to them. Everything about this situation was wrong. I had glass in my knees from the broken car window. I was angry at the police that were standing by there doing nothing to help. I was angry at the EMTs who showed aggravation that they had to be there yet again for another overdose. And I was even more angry at the people that stood by recording on their phones. Overdoses are traumatic to our whole community, not just the person overdosing, but for the responders, for our kids that live in them, and for our residents that live in them. We need to respond to this crisis the same way we would for any other body of sick and dying people. I work in these overdose hotspots every day. I have never saw Dawn before that day. I had later learned that she had just relapsed after being 8 years clean and sober. Dawn did not make it to see the next year, dying of an overdose shortly before. And the sad truth is, too many stories are just like Dawn's. We need to stop criminalizing, shaming, and discarding sick people. We are dying at record numbers, and we really need help now. Thank you.
Any questions for Ashley from the committee? Ashley, thank you for sharing that experience with us. It's very important.
Thank you, Senator Miller.
Yep. Next, we'll try to connect Michelle McKenzie.
Dawn did not make it to the next year, dying of an overdose.
Michelle? Michelle?
Hello?
Hi, Michelle.
Yeah, this is Michelle.
Go right ahead. You're on with Senate Committee, and please turn down your computer so we don't get that delay.
Okay. Good. Thank you very much, Senator Miller and committee members. Thank you for the bill and for allowing people to testify. It's been so impactful for me to listen to the amazing testimony that people have provided so far. I submitted written testimony, and so I'm going to be very brief. I invite you to read my written testimony. I am a public health researcher and have been focusing specifically on overdose prevention for the last 15 years. I direct a program called PONY, which is Overdose Prevention and Naloxone Intervention, and have worked with many of the people who've provided testimony today in distributing naloxone throughout the state. And it's been an honor to be part of the amazing community doing work to address the opioid crisis. And I have tremendous respect for the work of this committee and the legislature in doing really important work in addressing the overdose crisis. But as Ashley and many other folks have said, we need to do more. And while the idea of a harm reduction center or overdose prevention center is novel in the United States, it hasn't been done except for underground. Of course, as other testimony has pointed out, it's been done in other countries. And in my written testimony, I included a link to the 37 overdose prevention sites that are open and running in Canada. And it's amazing to go to the National Public Health website, and there's a list of the 37 sites that are open in Canada, and it's in 20 cities and towns throughout the nation. And so while it is true that it's novel, and it's definitely a challenge to do it here, and there's so much to be worked out with it, we would be doing it based on evidence. As Dr. Marshall talked about, this is not something we're not guessing about this. We know. And we also know that given the number of deaths that have happened, that we've experienced in the state in 2020, that we have to take this other step. It's a super complex problem. Harm reduction centers are not going to be the only answer, but they're a critical tool in the toolbox. So thank you very much.
So, any questions for Michelle? Thank you. You're a real important member of this effort and a real important member of the Overdose and Prevention Task Force. And I believe that's the last person we have to testify.
Thank you.
Before we go for a motion, and it will be to hold because we do have a lot of, we have not a lot really, but there will be some work we need to do on this bill before we consider it for passage. Before we go to that motion, I want to thank the committee. It's been a long night. What time is it now? 9:15. I hope you see this as valuable to sit through. I personally see it valuable. There's a lot of people that different people call as heroes, like, Tom Brady, or, maybe recently Eugene Goodman, who's the Capitol policeman that is now the temporary sergeant of arms who escorted Vice President last night or yesterday at noon. And they could both be considered heroes. My heroes are people like Dennis and Dr. Samuels. And AJ, people who have come out of recovery, and even Trevor, who went from bank robber to author. Those people are my heroes, and I hope you see that as valuable. and important. Is there a motion to hold for further study?
Move to hold for further study.
A second?
Second.
All those in favor, the clerk?
Senator Bell.
Aye.
Senator Culkin.
Aye.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Chairman Miller.
Aye.
Vice Chair Valverde.
Aye.